Hi, I'm a Perth County boy, and I've got some information on the cancer laws that have changed in Ontario, Canada, and the Phoenix Rising Center for Natural Cancer Research had formed a petition to fight against the health care changes in Ontario in 2019. And people I advocate for had handed me this petition to generate some awareness for, and I found a bit of resistance to some of the ideas of natural and remedies for that. And I would just like to read some of what I've written down, and I've edited since last year. So, just a moment. So I found more scientific studies, medical labs, and treatment groups that I alone can describe in a single paragraph. A simple list of centers and studies would be several pages. It would take too long to explain natural medicine and why it works, when it is more important to express why it is an important part of modern healthcare and cancer studies. Ontario Health, the name of the new superagency merger put in place by this Bill 74, has not included PSWs, autistic support centers, private practitioners, which includes family doctors, or at least most of them. I'm pretty sure they have their own organization to protect them. And we did not hear very much from them. Natural research centers, and I could go on. But to be clear, there are 20 medical groups and organizations that were to be included in the original budget plan that our premier and his cabinet had put forward in the end of 2018 for the new budget there. This means that additional needs or alternative or specialized healthcare requirements will not receive coverage under OHIP, which is the healthcare plan in Ontario, or offered as recommended programs by Ontario Health. So no medical staff will direct you to that, and there will be no referrals. And I've been given the petition by Diane Elms of the Phoenix Rising Center to be circulated, and the petition responded to Doug Ford's lack of a plan to replace the cancer treatment and prevention laws after his new bill C-74 abolished several legislations and created a loophole to steer clear of Canada's Federal Cancer Act. After changing environmental laws to in favor of natural resource development, which is already directly affecting public health, the Cancer Act RSO 1990, I've got a link to that. The Lung Health Act, which it was the Healthy Lungs of Ontario, that act has been abolished. And the Trillium Gift of Life Network Act, which it was the organ donation plan in Ontario. And I've got a bunch of consolidated laws, but the Lung Health Act, which protects us from pollution, which is smog, essentially was the big thing back like a couple decades ago, and we eliminated smog. We don't want that coming back. I won't go on because I could talk all day about the things that have been cut that jeopardize people's health in Ontario and that carry over to the rest of the world through our own actions here. So please share and subscribe, because I'm going to keep coming back with information like this. Thank you.